Hello, this is a little helpful YouTube for beginning week 3. So I want to walk you through a few things that you'll need to be mindful of. This is our Moodle website. Notice that you do not have the tutorial homework included any longer for weeks 3 through 9. There are no PrimeSuite EHR activities for week 10. So what I'd like to do is I'd just like to kind of scroll down here, and again, this is a screenshot in Moodle of what you will see in Connect when you go into week 3. Notice that each of the sub exercises 3.1, 3.2, 3.3, 3.4 have a demo mode, a practice mode, and then a test mode. And then I'm going to go into Connect here and walk you through. This particular document was located in the very beginning of our Moodle website for our course, and I asked that you read that, and if you haven't, I have placed it also right here in the area just below the instructions for week 3. So be sure to read this document before you begin week 3. Okay, so now what I'd like to do is I'd like to go over to Connect, and I'm going to open up week 3 here. And of course you're familiar already with the quiz and how to get into those things. So I want to just show you what things will look like when you get into doing each of the modes. So for example, you'll just click on this link right here to get into the demo mode. And what will take place is you just click on the begin demo mode, and you'll see the load.
Patient info
and then you'll have a narration, okay?
Click the Customize Patient Information icon.
And it'll guide you
patient picture
through what you need to do.
Select patient name.
Over on the right side, you'll see highlighted each step.
Patient ID.
Additionally, you'll be walked through each of these exercises step by step in the book.
Select date of birth. Select SSN.
Now I'm going to take you into the practice mode, which is very similar to the demo mode, but it begins to ask you to do different things along with. So you'll see this loading, and especially the first time you're doing it.
Click View Patient Info icon.
See, then it'll wait for you to do that.
Click the Customize Patient Information icon.
Whereas in the demo mode, it does it for you. So you need to go ahead, and I'm clicking on that.
Select Patient Picture.
So I click right there.
Select Patient Name. Select Patient ID. Select Age.
And then you also see the same thing over here. Now when you approach the test mode, then you're on your own, and you will be following, and you can use the book and follow the steps in terms of what you're going to be working on relative to what exercise you're on, 3.1, 3.2. So that's the way that Connect is set up to begin to interact with the EHR. Scrolling down further on the Chapter 3 in Connect, you will see different things in terms of what you'll have to do in terms of the practice information screen, registering a new patient, scheduling an appointment, editing demographic information, checking in a patient who has arrived, checking, capturing insurance information of a patient. So go all the way down to 3.7. Okay? And then these links, of course, are the links to take you to the ebook, to the digital book. And I want to mention just a couple of things with regards to the way in which these chapters now 3 through 9 will be set up. One of the things that you will begin to learn, if some of you haven't already learned, if you're involved in doing anything relative to computer technology or working with electronic health records, is that these programs are rather sensitive. And as you know, in healthcare, you need to be precise. This is a real EHR that you are working with. Granted, it's a simulation through McGraw-Hill, but Greenway Medical Solutions is a real EHR. And so accuracy and the linear approach with regards to step by step and having to follow the steps and the steps in the book is lending itself to how you actually will perform work when you are working with an EHR. So I want to just stress that it is important to be sequential. It's also important to go step by step, and you may have some sensitivities with regards to the loading of the software or, waiting on a screen, particularly if it's buffering or depending upon your particular device, your internet service provider, and that type of thing. So lastly, I'd like to just make a reminder to you that, McGraw-Hill tech support is available. Email or put a question on our website. I'm checking that frequently. I respond to email within 24 hours. So this week now we'll begin a little bit deeper into actually working with the electronic health record, and I think you'll enjoy getting into these administrative data elements and things that you're going to be experiencing during week 3. I will delete the demo mode starting in chapter 5. So I figure I'll give you the demo mode for chapters 3 and 4 until you get the hang of things and get a little bit more comfortable. But then starting in week 5, you will not see the demo mode. You'll just have the practice mode and the test mode for the different subcategories of each of the chapters. Okay. Good luck in week 3, and email or contact me via our Moodle website on the student forum questions, and I'll be happy to get back to you.